It's a novel treatment, it's non-medication, and right now not psychotherapy oriented. It's a magnetic stimulation of your brain through external ways to treat your depression.
Your TMS tech comes and puts something on your head and you're sort of like laid back. It's very comfortable in this chair.
During the mapping, we do this cool thing where your hand twitches, and it's just always very interesting to me.
My first time, they were adjusting the machine to me. It was kind of neat because when they first do it, they have to zero it in, and one of the things that happens is your fingers jerk involuntarily. And that was pretty cool to see that there was a link between the brain and my finger.
If I were looking at it as a patient for getting treatment for depression, would be to make it as simple as possible. We have one person who's the coordinator, and she does everything from the insurance eligibility to scheduling the appointments to actually doing the treatments.
Fortunately, the insurance process went pretty smoothly. I didn't get any rejections, I didn't get any pushback about it, and it all fell together.
Sometimes when you go to hospitals or huge organizations and it's hard to find your way around, and when you're depressed, that's the last thing that you want to do. So I think that one of the advantages here is that everything is in one building.
Everything is very kind and soft and gentle and pretty and welcoming. It's a whole experience here, and it's very comforting and welcoming. The whole package is here. The whole, everything's here.
I really enjoy getting to know people personally, and I think that it also helps the patient. To be able to have a safe place. People know your names, even if you've only been here a couple of times. And it's one of those things that it doesn't feel like you're going to the doctor's office. Because you walk in and there's all these bright colors, and there's lots of light, and there's dogs, and there's kids running around.
I was trying not to get the window
We really just learn a lot about the patient. Some of them have just these amazing life stories.
I think there was a way in which being in the chair and being in that room and being with Kim and with the other techs that I could become a version of myself that I liked more. I actually think that helped my healing process.
I've learned a lot about the brain. I've learned a lot about depression. I've learned a lot about almost all of our patients. I've actually learned a lot about myself as well.
I dearly like the two women who talked to me about books. And to this day, we still trade book recommendations.
Oh, my experience with Dr. Nora was very comfortable. She was easy to talk to, easy to ask questions. I felt like she was working not only really well with me, but really well with the staff around her. And she was very, very knowledgeable and helping me understand kind of what this process is all about.
But it's been 7 months, 8 months?
It's been almost a year, actually.
Has it?
Yeah.
Oh my God, it's February. I think when I first sat in the chair, I was hopeful that something would change. Sitting in the chair the last time was just a sense of elation and a relief that something I had done had actually changed my life. After TMS, it just felt like I could do anything. Like I just had so much energy, and I just felt like I could do all the things that I needed to.
When you look back, a week or two in, you're gradually noticing things were getting better. So it lifted the cloud that was over me.
I guess that's what it feels like, this gratitude to you guys, because I never could have done it myself, and I had done all these different things. And it was really only through TMS that I was able to.